MoveOn.org, Chicago Central Council, and we are here today because we're about to go upstairs to see both Senators Durbin and Burris' staff, and we brought them a message, as you can see. The message from Massachusetts is, Democrats, you don't vote, you fight. You stand up, grow a spine, you get health care reform done now. In fact, right now, we need it now more than ever. For the millions who are suffering. For example, myself, I haven't had health care in 20 years, and I need it very badly. There's lots more like me out there who are losing their health because they can't get the care that they need. Now, we got a message also for the Congress as a whole, and that is, MoveOn will be reevaluating how much support they want to give to any Democrats who don't stand up and fight. We may not be out there anymore knocking on doors, stuffing envelopes, making phone calls. So think about it, Democrats. 2010 midterms are coming up. We can make a difference to these elections. Also, we can't afford to wait any longer for comprehensive health care because of our economy. Right now, health care is 17% of GDP. We need to be careful how those dollars are spent, to make sure that those dollars are spent on actual patient care and to have care that actually gets people well, rather than lining the pockets of corporate CEOs and all of those other people working in their companies that are making outrageous bonuses this year. So we would like to call on our Senators Durbin and Burris, continue standing up, get a really strong backbone, make a difference, and let's get health care reform done right now. Thank you.
Yay! Yay! Yay!
All right. Now, anybody else like to just really quickly step up and just say what they're thinking about health care right now? Anybody have a chance? Come on, people.
I think you said it all.
They all speak with? Okay. Everybody that says that they think healthcare ought to be now, raise your hands.
Hey!
Hey! All right. Let's head upstairs and let's send the message.
More. Here comes some more.
That guy should have stuck around, huh?
Yes.
He thought there was nobody.
That's why I don't want to rush away too fast because
Maybe because I'm buffing.
not everybody can make it right as well.
All right, well, we've got a nice group for this. This will be cool. Now, for Senator Burris in particular, guys, it's going to be especially a thank you. This guy has just been a rock when it comes to progressive agenda. He has done everything and beyond that MoveOn has asked. So let's make sure that he really hears a good, strong thank you today.
It shows what you can do if you don't have to vote.
Not only that, but it shows principles, because actually they talked about their agenda when he went in, and his staff was actually saying you could play this conservatively and leave a nice legacy, and he said no way.
Free country.
He says, I'm for the people, that's why I'm here, this is what I believe, this is what I'm doing. Right? So this was personal principles. So it's really, really good.
That's too bad. That's too bad.
So while I'm thinking of it, I forgot to have her do that. I gotta whip out the sign-in sheets, Gabe.
Yeah.
Got the sign-up sheet.
You also need to make sure you talk a little bit about what we just did so we can kind of head it together.
And it was a great time. Scott Kagawa came out, the district director for Senator Burris, and he was, as always, very warm and gracious and welcomed us in. We asked him some questions about the healthcare reform process. He says that they are indeed going forward. They're not going to say quit, and they are now starting to look at things such as reconciliation. They've been talking with Reid, Pelosi, and the White House, and what they are trying to make sure of is that the legislation they write for reconciliation must adhere to the rule of being pertinent to the budgeting process. So it's very important that any healthcare elements that get put in that legislation must conform to the rules of reconciliation as determined by the parliamentarian. Now, this parliamentarian is a very stickler guy for the rules. So we're going to be very careful in how we craft this. And that's the process right now that's being talked about. Also talked about is, can we get the House to accept the Senate bill, or as close to that version that got passed as possible without jeopardizing it, if we give the House the knowledge that we're going to correct the other things in reconciliation. So if you hear that the Senate bill is being passed by the House, don't flip out, because that's just the beginning. It's not the end. It's not everything we're going to do. Okay, so there will be more. And to be truthful, civil rights, women's rights, none of those were completed when we got, for example, the Voting Rights Act or the Civil Rights Act or the ERA. None of those finished the process. It took a lot of time after we got those passed for us to add to them and to refine things and make it better. And that's the same process here. Healthcare will be a process, not just this one bill. It'll be not as good as we want at first, but we go into reconciliation, we keep adding each year, we keep refining and tweaking, and in the end, as we progress through this administration and beyond, we will have a wonderful health care bill that will cover everything we wanted. We just may not get it in this first bill. So everybody be patient, stick with it, don't quit, keep pushing. We all make a difference. And Scott's group has vowed that Senator Burris's entire office is committed to this process. So we are grateful to them, and Move On pledges. We stand behind those who stand behind getting health care done now. That's our pledge.
Great. Thank you.
To you. Who's all back there? Oh, you guys.
We appreciate you.
And could we just real quickly say what town or part of the city you're from? I'm from Brookfield.
I'm Melody from Middle Village area.
I'm Jerry from the Galewood area of Chicago.
I'm Mary Kay from the Lakefront Liberal Group.
I'm Candlin from the Avondale neighborhood.
Van, Chicago Liberals.
Awesome. Next,
Hey, where are you guys from?
you need to have your name and where you're from.
From Chicago, Lincoln Park.
Excellent. Both of you guys?
Yeah.
Excellent.
Patricia Spencer from Hyde Park.
Cool.
I'm a neighbor of Obama.
Oh,
Steve Howard from Old Town.
cool. Where are you from?
I'm Olin Ross, and I'm from the southeast side of Chicago.
Excellent. I didn't get you, actually.
Sandy from Brookfield.
Excellent. And I'm Caroline. I'm from Oak Park. Yay!